we're discussing how to combat chronic diseases in Black communities. My name is Dr. Erica Steele. I'm a board-certified naturopathic doctor. I hold 6 degrees in my field, all in the natural healthcare space. I like to say that I went to school so you don't have to. All this month, we're talking about the colonization of our healthcare system, and we have a free webinar that I've put together myself. It's an instant view. You can go ahead and click the link below and check it out. It's definitely well worth the education. I go over the history, I go over all of the things that you need to know about your healthcare and about how to decolonize it. So let's talk about chronic diseases. So unfortunately, Black Americans are the leading community demographic of chronic disease. And in fact, the Commonwealth Fund study just came out in 2024, highlighting that in all of the states in the United States, Black Americans receive 52% subpar treatment across all factors: healthcare, outcomes, access, etc. So a lot of it has to do with so many different factors, and I want to touch on a few. One of them is a lack of education and a lack of literacy. Oftentimes, Black Americans don't know what they don't know, and so they have been put into communities, food deserts, restrictive education, and not really given a fair chance. And so some of us in the Black community have been privileged enough to not be in those certain communities. And so we've been able to get some education, but in reaching into other communities, there's still very much resistance around that. Let's take healthy eating, for instance. I know a lot of people love, fried things and, high fat, high sugar, high sodium, but the diet is absolutely killing us. And so making sure that you are not eating, that traditional slave diet, unfortunately, I hate to say it that way, but that high sugar, high fat, that really, just very, it was scraps. I mean, if you look at the history, it wasn't our nourishment, it was what we adapted. And unfortunately, many people are still eating like that to this day. And I know we've adapted culturally because naturally we were taken from our cultural communities, and so we adapted and we make something out of anything. But it's a time in our modern world that we need to get off of the food supply. But the first step is really understanding the food and the impact that our food has on our system. So that's number one. Really getting into the communities themselves, attending health fairs. I know a lot of times I attended health fairs in churches. I would do a lot of free, educations, teachings, etc. So ask around in your community, churches, your gym, your rec centers, etc. They may have offerings to help educate you. Really, it's about you empowering you. No, unfortunately, no one is going to save you. No one is going to fix it, and nobody is going to provide you the information. You have to want to seek it out. And I know that can be incredibly hard. I have absolutely free information on my YouTube channel. So if, economics is a barrier, or even just lack of knowledge. And so if this is all new to you, this way of thinking, educate yourself first before you spend a dime with any provider. Educate yourself about the field of study that provider has trained under. Research that provider's schools. Research what that provider did to get there, because you'll have a better understanding of their approach when it comes to dealing with chronic diseases. It has to be greater than a management of medications. Oftentimes in my practice, I've seen, hypertension patients come in and they're on 3 and 4 different hypertension medications. However, they're not asked simple questions like how much water are you drinking every single day, or how much sodium you're consuming every day, and teaching the patients how to track their sodium. So for instance, if you have hypertension, before you go and spend money on a provider, etc., first look at how much water you're drinking. You need half your body weight in ounces every single day. Number 2, you need to make sure that you are tracking your sodium. I know you may not add sodium to your diet, but sodium is in a lot of food already. And so you want to make sure that you track that and keep it no higher than 1,500 milligrams per day. Some would even say 1,000. I wouldn't go under that. And so making sure that you're getting adequate amounts of water, hydration, but also, making sure that mineral exchange is where it needs to be. There is so much information that is being exempted from the Black community that is not being told. There is a reason why people that look like us are restricted from being models, because unfortunately there is no money in the cure. There is only money in the disease management. And so if you want to be unconscious to that, you are going to be a victim to the colonized healthcare system. And right now, we're all a victim to it in some way or fashion. We have all been impacted in some way. And some of us are fighting the good fight every single day in the healthcare system, whether you're a patient advocate, or a provider or healthcare professional within the system. We're all impacted by a system that really wasn't made for any of us and really isn't helping us, and in fact is harming us on a grave level. I think statistically I saw 10 in every 1,000 Black babies every single year unalive. And I think it's 1 in 3 or 1 in 5 of female for maternal mortality rates. And so we have serious concerns that are happening within the Black community when it comes to the healthcare system. And unfortunately, these concerns are not being addressed, not being communicated, and not being helped. And so our elders are getting sicker and sicker. Our children are more unhealthy than they ever have been, with staggering rates in neurocognitive developmental issues from various different perspectives. And medication is not always the answer for everybody, and also medication is not always not the answer for people. But we need to be able to look critically at all cases, and we also need to be able to be allowed to be the freedom to not have to go through all kinds of regulations and red tape and fear of persecution and all kinds of other issues, simply trying to help a patient heal. A doctor is teacher, and so that is our role, to teach our patients, not to necessarily co-opt them, manipulate them, coerce them, force them, look down on them, or any of the authoritarian attitudes or superiority complexes that currently exist within our healthcare system. As a naturopath and as a non-regulated, if you will, healthcare provider, I have been looked down on so many times I can't even mention. And even I'm sure in some of the comments on social media, you'll see that. And it's because of this model. It's because I am deemed as inferior in the superior model, where all conventional healthcare practices are considered the favorable, and then all of our natural indigenous practices that have been passed down through our families have all been now demonized, called names, and we've been told that we're crazy and everything else. This is medical gaslighting. I know people don't want to call it that term, but that's what it is. And I have story after story after story about this phenomenon. So something has to change. Cultural sensitivity and culture integration into our healthcare system, but also to political oversight, because a lot of this has happened based off of a lack of political oversight. Another issue that I would like to address and bring to your attention is regulations have been allowed to provide advertising to consumers. It's called direct to consumer advertising, and these direct to consumer advertising is been done now on low health efficacy medications. That means medications that didn't necessarily do well but still need to be moved. Now there are ads, I'm sure you can see them right now on various different platforms, Instagram, Facebook, you name it. And so these ads say, ask your doctor about XYZ, right? Ask your doctor if you have blah, 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 right? Why would we want to ask our doctor if our doctor is the one that is trained to look for and identify and deliver a treatment plan, right? It is designed to now get the patient to be the consumer and drive the process. So there's a lot of subtle messaging in the healthcare system throughout, even in television. Anytime there's a natural provider that's put out, we're demonized, we're weaponized. All kinds of different government bodies tend to be weaponized against us as well. Again, I have all of my own stories, about it, but the end of the day, that many of us still do not fight so that Black Americans can have health. If people really knew how simple it is for them to heal, if they could really critically look at things, logically look at things, but more importantly, process the emotion and process the trauma that we've been through, which is very difficult in a current system that doesn't acknowledge the impact of what has occurred to Black Americans, which is definitely why I am for reparations, especially to subsidize healthcare. I truly believe that also all Black Americans need things like an EEG, acute EEG, neurofeedback, biofeedback, neurostim to help with the brain developmental trauma that we go through almost every single day with various microaggressions. I, for many years, thought as a Black healthcare provider that it was just me, that for whatever reason, there was something bad and wrong with me when I would get all of these bad reviews, when I would get, called names, when I would be, bullied online or whatever, and of course I handled it with grace and I handled it with class and, I let them know what time it was. But at the end of the day, why me trying to protect Indigenous as well as Black Americans' healthcare practices, I shouldn't be met with so much vitriol. But the reason I found out that I've been met with so much vitriol is really because the healthcare system is deeply colonized. And so because of that, I am definitely public enemy number one in that fight. And so I definitely encourage everyone to look through a critical psychology lens, learn more about your healthcare system, learn more about healthcare system practices, and of course, like, share, subscribe for more. We have our webinar. It's totally free, instant access. Just click it right below and it will definitely help you in your journey to decolonize your healthcare.